The Biopticka Laboratory in Plzeň is the largest laboratory accredited by the Ministry of Health to perform screening cytology examinations. Last year we processed 900,000 of these screening cytologies, and a substantial part of this consisted of the so-called liquid-based cytology (LBC) method.
The nationwide leader in the processing of collected smears is the Biopticka Laboratory in Plzeň, Czech Republic.
We collect material from gynecologists at various intervals, twice, 3 times a week, from some once a week. Cytological examination can be performed either in the form of a so-called conventional smear, when the gynecologist transfers the collected cells from the surface of the cervix onto a slide. This slide is then transported to the laboratory, where we stain it and evaluate it under a microscope. In addition to this, I would say traditional and historical method, which has been used for more than 80 years, the Biopticka Laboratory also performs evaluation of gynecological cytology using the LBC method, the so-called liquid-based cytology, when the gynecologist does not place the cells on a slide, but transfers them into a vial with a fixation fluid. This is able to preserve the cells in perfect quality, not only during transport to the laboratory, but also afterwards for a period of 6 weeks, when the vials are stored and archived here, and the gynecologist can subsequently request some additional supplementary examinations. Most often it is an HPV test, but we also perform evaluation of microbial flora, as well as other immunocytochemical or genetic examinations. For a woman, it is a huge advantage that she does not have to go to the gynecologist again, but that from this one sample, we are able to perform many additional examinations.
And what does the processing of samples from patients look like in practice? Digital technologies and, more recently, artificial intelligence are a great help in the Biopticka Laboratory. They bring patients the certainty of the highest possible quality of analysis.
We have been using an imaging system, that is, computer image analysis, since 2011. But from 2024, we are transitioning from this technology to a completely new digital technology and the Genius system. This is a scanner from the company Hologic. We insert slides of liquid cytology into it, which we have prepared in the laboratory, and the scanner essentially converts the cells into a digital image. If we scanned only in one layer in the usual way, as is commonly done and as we know it, then given that the cells are of different sizes, we could have a blurred image in some places. But with this scanning in 14 planes, the result is the creation of an absolutely perfect image, in fact, a virtual slide of perfect quality. The Genius system, that is the preparation of a specimen using liquid-based cytology, the scanner and all review stations, have EMA certification for the European market and FDA certification for the USA.
Artificial intelligence helps to examine tens of thousands of cells in a single sample, and because it knows exactly what precancerous or already cancerous stages look like, it can find them quickly and efficiently without the system overlooking anything.
We are now in the room where the review stations are located. It is a complete breakthrough in the history of work in laboratories that process gynecological cytology. We are among the first in Europe where this most modern technology is available, and the only workplace in the Czech Republic. A fundamental change is that we do not have microscopes. This is a complete novelty for us, but we have artificial intelligence implemented here, so of course it moves the examination to a completely new qualitative level. In the slide of conventional gynecological cytology, we can have up to 200,000 cells, and de facto we should responsibly evaluate all of them. In this system, the number of cells is greatly narrowed. We have a total of 60 fields that we should look at, and from these 60 fields, we are already able to make a conclusion.
Early screening of cervical cancer can prevent the development of this aggressive disease.
Participate in cervical carcinoma screening and undergo preventive examination. Ask your gynecologist about the possibility of a more precise evaluation of your gynecological cytology using the Genius digital system with artificial intelligence.